Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
And hello again, everyone, and thanks very much for joining us. Again, we devote the broadcast to Arkansas and the coronavirus. Again, we focus on the challenges to our citizens and the medical professionals who look after us, EMTs, nurses, technicians, and doctors. About doctors, Arkansas has graduated about 200 this month, half of them the first class of its newest medical school. More on that later in the program. First, the COVID outbreak itself and the troubling ethnic disparity in its victims, the numbers and what can be done about them. To address the demographic challenges, UAMS and the State Health Department have created a new partnership at the urging of State Senator Keith Ingram of West Memphis, who joins us. And also with us is LaShannon Spencer, CEO of Arkansas Community Health Centers, which target the medically underserved. Senator Ingram, both of you, thank you very much for being with us. Senator, we'll begin with you. This new venture between UAMS and health, what is it you wanted to do? What is it you expect to do?
Well, obviously, the numbers show us that there is a disparity among minority groups in not only contracting the disease, but in the number of deaths. We've got about a 15% minority population in the state, and right now the deaths are about 40% or so are minority. So I think that my thought was to urge UAMS and the Department of Health to collect the statistics as we go so that we can see what the correlations are and address those for future generations.
Well, beyond just collecting the data, Senator, and by the way, your statistics agree with mine. On the top end of the estimates that I was able to find, the African-American population in Arkansas on the top end is 16%, and yet 40% of the COVID cases and 38% of the deaths. Beyond collecting the data, is there something more that you would have the UAMS, the health department, do? Is the collaboration going to be greater than just the collection of statistics?
Oh, no question. We want to collect the data and look in, and of course, I think a lot of this we know that we have in the Delta, particularly higher obesity that leads to higher blood pressure. We have a disproportionate number of individuals that have asthma, a number of different illnesses that contribute to the of their immunities being compromised against something like this virus. And so I think once we see the statistics, we can use those to pair them against the vaccines that come out to make sure that the vaccines will be useful for everyone.
Ms. Spencer, the maladies that Mr. Ingram just mentioned, obesity, hypertension, diabetes, asthma, the others, I saw a reference to them the other day as pre-existing epidemics. They greatly preceded the arrival of COVID-19. This is hardly revelatory to you.
Absolutely. And let me just thank Senator Ingram for his work and just looking and having the fortitude of understanding the significance of putting together such committee. But what is very clear, health disparities have always existed for African Americans. This is nothing new. And like Senator Ingram talked about, the ratios of hypertension, heart disease, diabetes, also lung disease, and just asthma continue to plague not only the African American community, but I would actually say lower income community as well. And sometimes things that are happening in the Delta also translates to North Arkansas and just within our rural communities. So as we begin to look at the health disparities and COVID-19, as I think about it, it's just the higher underlying conditions and the lack of access to healthcare services that has really impacted the higher rates of individuals with COVID-19, but also a lot of African Americans have essential jobs. when I mean essential jobs, they are usually jobs where they're in contact with more individuals, and often those individuals have other chronic diseases as well. And then so often there's insignificant or information, a lack of information. And then housing disparities also contribute to the chronic diseases that continue to plague so many communities across the state of Arkansas and across the United States.
Ms. Spencer, what are you seeing at the clinics that your organization encompasses? We have heard reports that many healthcare institutions, particularly in rural Arkansas, are being especially stressed because people are simply afraid to go because of the pandemic.
I agree, but our health centers are actually taking the necessary precaution to ensure that not only are our healthcare workers being safe, but also the safety of our patients just as well. And Senator Ingram, just knowing what has actually occurred over with East Arkansas Family Health Centers and how those healthcare workers are doing mass testing and taking every precaution and wearing the necessary equipment to protect themselves, but also patients as well. But what we're finding is just the lack of information and people not knowing the significance and the importance of actually being tested. There are so many myths that no, we don't necessarily need to practice the social distancing, or I won't get COVID, or it won't affect the African American community. And that's not necessarily so.
Well, Senator, you're over there your district over there on the banks of the Mississippi, and it encompasses an awful lot of a lot of territory. Are you seeing that sort of, I don't want to call it nonchalance, but a lowering of the guard?
Well, yes, we have a little bit of both of that, Steve. We are a rural Delta area, but we sit next to a major suburban area in Memphis and Shelby County, Tennessee, where in Crittenden County, we've probably got somewhere around 7,000 individuals that traverse the bridge every day that live in Arkansas and work in Memphis and Shelby County. And so we are exposed to a much greater chance for spread of the virus. For instance, Shelby County is going to have probably as many or more deaths in Shelby County alone than in our entire state. And so we have to take some precautions that maybe some other rural areas don't. The encouraging thing is that local leadership has really gotten involved. Mayor Cedric Williams in Forest City, 1 week they had a drive-through test and they had less than 100. And he got involved and really promoted it. The next week, the health department came in and they tested over 550 individuals the next Saturday. And the only difference being was the public announcements, the leadership shown by the Forest City mayor and council and the leaders of the community. So these are the things that we're going to have to do and continue to stress that to make sure there's no hesitancy about being tested.
Yeah, what do you want, Senator? What do you want public policy to address now? What's the next step for state government?
Well, as far as it relates to this, continue to expand testing and then tracing. I mean, we've got to do contact tracing in order to really minimize the damage that the virus is doing. I don't think that, I think it's very important that the public know that more than likely we're going to have a major reoccurrence this fall. We need to learn from what we've done good, and we need to learn from some of the gaps that have happened in order to better address them. Again, I mean, you take Shelby County, Tennessee, they are about a 7% rate overall infection rate. And, Arkansas has been just a little over 2. So we've just got to continue doing these things and continue to do more testing.
Senator, do you think we're opening too fast?
I'm concerned about it because it sends a message that I think that it's a relief, and life is returning to normal. I think that we cannot, we can't we've got to continue to hammer home the message that there is responsibility that comes with the reopening, that there is personal responsibility. And when I walk into a grocery store, and see maybe only a third of the people wearing a mask in the grocery store, it sends a scary message to me.
The senator, Ms. Shannon, is echoing what national health authorities are saying, that they greatly, in fact, they predict a resurgence of the virus come autumn. You share that concern?
Absolutely. I definitely share that concern. And I think Senator Ingram did not give accolades where they were due. Crittenden County is a very unique county, and you asked about what's the solution. So many partners have actually come together along with elected officials and community organizations to actually try to address and ensure that that number is decreased. So we're going to have more of a collective partnership with not only just local elected officials, but faith-based leaders as well, and community organizations. And I too share those same sentiments. When I walk into a venue, people are not covered with a mask or just protecting themselves, it just gives me great angst. Or just even in a line and there's not that 6 feet of distance, I have to remind people, hey, we need to be mindful of this social distancing. Or I just clam up knowing that I'm only traveling to work or from home, and just limiting myself with the interaction with people, because I'm cognitive of the folks that I have to interact with on a daily basis.
Yeah, Ms. Shannon, if I may, let me sidestep just a moment to ask. I have read over the last several days many accounts of physicians, health pros such as yourself, being deeply concerned that because of misinformation, apprehensions, whatever, that the rate of childhood immunization is far below where it needs to be, where it ordinarily would be. Presumably parents being afraid to bring their children in for measles, mumps, rubella, the other customary immunizations. Are you aware of that trend?
And what you just stated is absolutely correct, and even just from the immunization perspective. But what I want to reassure to individuals, health clinics, health facilities, FQHCs, they're safe. They're making sure that not only they protect you, but they're protecting the healthcare workers. So parents, please do not be concerned about taking your child or children to make sure that they get their vaccination.
Yeah, Senator Ingram, back to you. It seems like any number of individuals and organizations want the governor to call a special session. One of he's under, and has acknowledged from the start, that he's under a lot of pressure to open the state back up pretty quickly. But he's also under pressure now from the state chamber and other organizations to immunize business, or through the General Assembly, call a session to immunize business from COVID litigation. What's your sense of that? What's your reaction to that?
I have just seen actually the proposed legislation this morning, and it is one-sided to the employer. And for this thing to be fair, it's got to be fair for the worker as it is for the employee as the employer. There's no standards or guidelines that the employer has to meet in this legislation, nothing that CDC recommends. And so, as I say, it's got to be fair for both. I'm concerned that, I don't understand what the rush to do this is. Certainly, a lot of cases have not been filed. I'm aware of many businesses right now that are asking patrons to sign waivers when they come to have their hair done or hair cut. So to have a special session on this, I'm just very concerned about it. That's money that we could be spending, quite honestly, to use to fight COVID. So I want to remind, as I said the other day, that these are the same people that pushed cutting unemployment insurance for our workers from 26 weeks to 16 weeks. So if there is a special session and the governor deems that they call, I would imagine that there's going to be some other things that will be brought forth, such as repealing that legislation to take it back to 26 weeks from 16 weeks. So we'll see how it all shakes out.
Ms. Shannon, we've got a few seconds remaining in the broadcast, and I'll let you have it. Is there an overriding lesson in what we've gone through the state for the last 4.5 months?
I do, and data, collection of data, having a statewide system, because this is just the beginning to many pandemics or state emergencies that will occur. Having a uniform statewide system could actually be helpful, where epidemiologists and clinical informatics can actually go in and look at the information and to be able to drill down and look at individual health, zip code by zip code, race by race, age by age, to be able to do some more predictive analysis that's needed pertaining to individuals' health. But also, we need to make sure that we have the necessary resources. And just us not having access to PPE supplies, and this was a statewide issue, a national issue, making sure that we have the resources from testing supplies to patient information, and patients being aware of what's needed and to ensure that they remain healthy just as well.
And with that, our time has expired. Ms. Shannon, Senator Ingram, thank you very much for your time. Thank you for being with us. And we're back. An odd coincidence, but a hopeful one. Amid a pandemic that in Arkansas has sickened almost 5,000 people and killed more than 100, our state has scores of new doctors. Some from the state's first and since statehood only medical school, UAMS at Little Rock. But 100 new doctors are the first graduates of the School of Osteopathic Medicine at Arkansas State University. It's a partnership with the New York Institute of Technology. The graduates must still conclude a residency program, of course, and where they will eventually practice isn't certain even to them. But the great majority of the graduates are entering primary care, family medicine, obstetrics, pediatrics, disciplines crucial in making states such as ours healthier. We're joined now by the ASU Med School's Dean, Dr. Shane Speights. Doctor, thanks very much for being with us. And congratulations to you on this first class, and of course to the graduates themselves.
Thanks for having me, Steve.
One of your announced objectives in creating the school, or the institution's objectives in opening the school 4 years ago, I guess now, was to put primary care physicians in underserved areas such as rural Arkansas, the Mississippi Delta. Is there any way of knowing in advance right now how many of these physicians, or about to be fully credentialed physicians, are going to locate there?
You know, it's hard to know what the eventual outcome would be. So what we did was, when we started the program, we looked at the data. We looked across the country and we said, okay, for those programs that are successful in terms of getting physicians to practice in rural and underserved areas, what's the recipe? And we knew the recipe, or part of it, was to get them to train in those areas. And so we were intentional from the very beginning with our curriculum in terms of how we integrated things like population health and population medicine, and the need for servant leadership in communities, the need to serve rural areas. We started that even in the first year. And so then it continued on into their third and fourth year, into their clinical rotations, where they get much of the hands-on part of medical school. And so the way we were able to do that was we were able to partner with lots of hospitals and healthcare organizations all across the country and all across the Delta. We've got our students in about 33 different counties just in the state of Arkansas alone. And they're working side by side with frontline physicians in terms of what it's really like to practice in Mena and in small towns, even down into Pine Bluff, Warren, those kinds of areas just all over the state, Northeast, Northwest, but specifically, southeastern Arkansas.
What specifically are they permitted by customary practice and also by statute to do at this, rules and regulations to do at this time?
So in terms of, you mean after they graduate from medical school or during medical school?
Well, right now, doctor, the services that these new graduates can, or the students themselves, or particularly the graduate, what kind of services, what kind of assistance are they lending to established physicians and institutions?
Right. So this is very specific in terms of how a physician education occurs. And most people may not be aware of this. After you complete 4 years of medical school, you can't practice medicine. You can't practice anywhere for the most part. That's what residency is for. So they go on into residency where they choose their specialty. So those that want to go into family medicine, go to a family medicine residency. Those that want to do neurology or surgery, they go to those specific programs across the country. And so our graduates went into programs, obviously in Arkansas, but also across the Delta region and across the country to do additional training. The gap in between medical school and residency doesn't allow for a lot of actual hands-on training or doing for the most part. But we can use them in the 4 years we have them in medical school. We can have them start making an impact early in terms of the communities that are in the most need, specifically here in Arkansas.
And that's exactly what I was talking about, sir. What services can they provide? Are they making an impact already, particularly in this period of coronavirus infection?
No, absolutely. They become part of the workforce pretty quickly, and they become the extra set of hands. You know, these are students that have had a good solid 2 years of medical school. Then they go into these areas, and even those that are in their first 2 years, they can help with contact tracing. They can assist physicians that are involved with telemedicine visits because we do train, and we're one of the only medical schools in the country that trains students in telemedicine starting in the first year. And so we have actually that as a core part of our curriculum that every student graduates with. And so obviously it becomes invaluable in a time like this, where for some people this is new technology, but for all of our students, this is something they were trained on in the very beginning. We do work obviously in the Delta region. We have been successful in getting a grant from the USDA for the Delta Caravan, which was a partnership with several institutions to be able to help provide needed resources and screenings to rural and Delta areas, specifically on the eastern side of the state. So our students are involved in lots of different outreach projects to be able to start making a difference in those communities even before they graduate.
To the virus itself now, Doctor, you're in a side of the state, the Mississippi Delta area over there. You've got a number of hotspots now with your connections with all the existing healthcare, the framework of healthcare as it exists now. Can you give us your assessment of the situation, say, east of Lono County?
Well, so it shouldn't be surprising to anyone that's been following this globally or across our country that population density matters. And so where you have clusters of people, the virus can spread more rapidly. One of the things that's been obvious to most as well is if you look at Shelby County in Tennessee, specifically the Memphis area, those numbers of infections have almost been tracking just a little bit behind the entire state of Arkansas. And so you're talking about thousands of infections in a very confined area. And we do see spillover into the eastern side of Arkansas. Correctional institutions have obviously been playing a role, as we've seen that through the governor's press conferences and what Dr. Smith has put out. And so we're not immune to that either. But population density, again, does matter. And we'll continue to see that. That's not a surprise.
Well, there continues to be, and as Mr. Hutchinson and Dr. Smith and among others have pointed out, there continues to be a disparity in terms of diagnosis, in terms of early treatment of the virus, among other maladies, in communities of color and income. Can this situation be alleviated fairly quickly?
I don't know that much of the situation can be alleviated quickly. I think that we can deploy resources to help mitigate some of the outcomes that we're seeing. Specifically, when you talk about different populations, the studies are pretty clear that for most people, they trust a physician who looks like them, who sounds like them, who can relate to them. And so making sure that we've got those kinds of resources and those kinds of individuals in the areas that are needed to be able to provide good information, to dispel myths and rumors. There's a lot of that. I mean, it's hard to keep up, just even myself, when you see the things on social media, on the internet, So imagine for someone who's out in some of these poor, rural, disparate areas to try to keep up with what's true and what's not. And so that's one of the things that we've been trying to do, certainly at NYIT, is put out good information through social media and through websites, as well as using our students as that platform to be able to kind of raise the level of healthcare in this area.
Well, the key to it, it would seem, is certainly physicians who would appear to be, culturally attuned to their constituency. Yes, but the immediate problem, it would appear, is to get more and more providers in there.
Absolutely, which is one of the things that was the mission from day one in terms of what we expected out of this campus was to really be able to push the needed generalist specialties. And what I mean by that is it's typically called primary care. We needed more family medicine physicians. We need more general internal medicine physicians. We need more pediatricians, general surgeons. Those are the things we needed. So we were very happy with our match results that just happened in March. We hit a 95% match rate, which is higher than the national average for medical schools across the country. We had almost 72% go into primary care. 36% of our graduates went directly into family medicine. So we're very proud of those numbers. We're very proud that, again, the recipe that we're cooking seems to be working. We can obviously improve upon it. We plan to.
Well, Dr. Shane Speights, Dean of the Medical School at ASU, thank you very much. Congratulations again to you for your first class and to your graduates. Thanks very much for being with us. That's it for us for this week. We'll see you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.